hopefully make that all that you do in your science class, actually people do use it in real life every day.
Might be better if you put it in the middle of the aisle and lower the
So,
podium.
does anybody know what a pediatric
So they
cardiologist
could see
is?
that and him.
That's a good idea.
That's exactly right. Good job. Okay? Anybody know what's wrong with this? Yeah, that's not really what a heart looks like. It looks like something like this. Nice and disgusting. Okay? So huh? I did not bring the actual heart, but if Hannah would like to donate first to everybody in review, we will gladly take it out today. Yay! But no, it's exactly right. That's what it is. So, does anybody have an idea how you become a pediatric cardiologist?
Med school.
I got some med school, but it doesn't start there. What's step one? Yeah, high school. Step before that. Middle school. All right, that's right. You got to listen to your 7th grade science teacher, okay? So next time, if you want to become a start paying attention now. Start studying and start working hard. So you get it right. You got to graduate high school. You'll learn biology, chemistry in high school. Then you go to college. Anybody here going to go to college? Come on, more hands up. This is the college that I went to. This is College of Charleston in Charleston, South Carolina. Very pretty, nice spot. But you spend 4 years in college. So what happens after college? Med school. That's right. I went to a med school called Medical University of South Carolina. Anybody know how long med school is? 4 years.
4 years.
All right. You know what you would do then after?
Internship.
Residency. Very good job. Yep. So you do a pediatric residency. So in order to first, I got to do pediatric residency. Learn how to become a general pediatrician. Okay. Anybody know how long that could be?
2 years.
3 years. This is where I did it. I did it at Texas Children's down there in Houston. Okay. So 3 years. All right. So now, what else do I have to do afterwards? I got to do my pediatric cardiology fellowship. So that's what you do after. So after you come, anybody have a guess how long that would be?
8 years.
I have 7 years. I hear
5 years.
4 years is correct. That's where I did mine back in Charleston, South Carolina. So if you add it all up, anybody can do math? 15 years. That's right. After high school, it's 15 years. So if you think about it, most of your doctors are old. Yep. They're old. Alright. So what does a pediatric cardiologist do? First, we're going to talk a little bit first about what the heart does. Okay? This is a video, can't get to play unfortunately, but that the Children's Hospital of Philadelphia put out. The right side of the heart here is in blue on purpose. We'll talk about why. The left side of the heart here is on red on purpose, and we'll talk about why. So right here and here, you can see these are two large veins coming back from the heart. This vein drains all the blood from the top of from your head and your arms and your chest. This vein draws all the blood from your abdomen, your legs, and everything else. So after all the blood has gone to your tissue, it comes back to the heart. It collects in this top chamber called the right atrium. That then goes through this one valve called the tricuspid valve to make sure that blood only moves forward, not backwards, into what we call the right ventricle. Okay? The right ventricle takes this blood and pumps it up to this big artery right here called the pulmonary artery, which is just a Latin term for lung artery. So it goes out to the lungs, okay? Because as it comes back from the body, it's missing oxygen. So it goes back to the lungs. Y'all just finished the respiratory system, right? What's the biggest reason, the purpose of the respiratory system?
Breathing. Exchange oxygen.
Exchange oxygen. Very good. Exchange oxide and get rid of carbon dioxide. So this is what happens after all that carbon dioxide and the oxygen is taken up by your muscles and your organs. Then it deposits carbon dioxide. The right side of the heart collects it and pumps it to the lungs so it can get rid of the carbon dioxide and pick up some oxygen. After it goes to the lungs, which would be out here, but not pictured, so you can see the heart, it comes back through these veins right here. These are called the pulmonary veins, which was pulmonary is just a term for lungs. So it's the lung veins, so it brings back. And it's the only veins in your body that have a lot of oxygen in them. Every other vein in your body has low oxygen in it. So that oxygen-rich blood with less carbon dioxide comes back into something called the left atrium. So right atrium, left atrium. All right, we made the anatomy in heart a lot easier than a lot of other parts. Okay, left, right. Okay. Atrium talks about the top chambers. Ventricle talks about the bottom chambers. So that oxygen-rich blood comes back to the left atrium, goes across this valve called the mitral valve. Once again, make sure the blood goes forward, and then gets pumped from the left ventricle, this big blood vessel called the aorta, and delivers it to the whole body. Okay? So, what does the heart do? Its job is to pump blood around your whole entire body. To your lung arteries first to pick up the oxygen, to get rid of the carbon dioxide. Then when it comes back from the lungs, it's to pump it to the rest of the body so you can get blood. How does the heart stay organized? So each beat is something that has to stay organized. You can't just have things contracting when it wants to, and it has to work together. So the top chambers usually contract first to fill up the bottom chambers, and then the bottom chambers are the ones that do most of the pumping. And it's fun. It stays organized because your heart muscle actually has its own electrical system in it. It's sort of depicted here. It starts up here in something called the SA node. And it won't, this video won't play, sorry, it won't get labeled. Okay? So it starts up here in the right atrium in the SA node. It starts in the electrical impulse and it travels down. And you can see it travels multiple different ways through the right atrium, and it makes it down to something right here in yellow. That's called the AV node. The AV node holds on to that impulse for a half second, thinks about it, and then sends it down through the bundle branches to the ventricle. Okay? Then it stops. The electrical beat stops, pauses for a second, and then it starts again at the very beginning of the SA node. Okay, so that's how it stays organized. It has its own electrical system to keep those muscles working. How does it make sure that blood goes forward? Okay, so blood, if we're pumping, if we're squeezing, we've got to make sure the blood goes forward, not backwards, because it's not effective. So, once again, your blood comes in here. It gets pushed through this valve, the first valve called the tricuspid valve. So when the atrium contracts because of that electrical signal tells it to, it pushes blood across this valve, which is a one-way valve. So it'll open and let blood go from the atrium to the ventricle. Okay? However, when the ventricle starts to squeeze, which what happens is this valve closes, the tricuspid valve, and this valve, though, the pulmonary valve, opens. So it shoots blood forward. If this valve, tricuspid valve, wasn't there, then when you squeezed here, half your blood would go back and half would go forward. And that would be pretty darn inefficient, because you want blood to always move forward. On the left side of the heart, you have the same thing. You have the left atrium that squeezes, and it goes across the mitral valve to go forward. And then when the left ventricle squeezes, this mitral valve closes, and this valve, the aortic valve, opens. Also, how do you continue to move forward? Because this is, all of your heart is muscle. Okay? So when your muscle contracts, it's going to force blood forward, and those valves are going to make sure it only goes one direction forward. So the atrium, or the top chambers, and they have muscle, but it's a lot thinner muscle. It's not as strong, so they don't have to pump this far. The ventricles are the real hard pumping part of your heart, and they're the ones that do the majority of the pumping. Now your left ventricle pumps to your whole entire body. Your right ventricle only pumps to your lung. So which one do you think of those two as bigger? Left, yeah. So if you can read real quickly, you can also see left side is stronger and bigger. The other part of that, though, is just as important as the ability of the muscle to contract, is the muscle has to take time to relax. Because if the heart doesn't fill with blood, it's fine if it wants to contract constantly, to sit there and squeeze, 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 but it's got to fill up. Just like a balloon. You got to let the balloon fill up before you push water out of it. So each time, you need a time period of relaxing that's important, and a time for it to contract. All right, so that's a real brief. Before I move on to a little bit more about what I do on a daily basis type of stuff, does anyone have questions about how the heart works? Yes?
Oh, why do you experience heartburn? Like, whenever you're...
Yeah, so heartburn itself is a misnomer. Okay, it doesn't mean you actually have heartburn. What it usually is so right behind your heart, y'all will be learning about the esophagus. Okay, so you have stomach acid, and sometimes when you eat a whole bunch of a lot of sugary stuff, that acid will reflux up and it'll go in the esophagus. So it feels like it's coming from your heart, but it's actually coming from your esophagus. That's right behind it.
What happens if you can't feel your heart?
Huh? What happens if you can't feel your heartbeat? If you're awake and you have the ability to feel and say, oh, I can't feel my heartbeat, your heart's still beating. Okay? That's a good thing. It's really impressive. Everybody, I can look right out here, everybody's heart is beating. Okay? All of you. Because if your heart starts beating, what happens to you?
Die.
Yeah, you pass out first and then you die. But yes. Yes.
What's it called if it's irregular heartbeat?
Oh, good question. So we can talk about it. So that's arrhythmia.
Oh.
It's a big term for just means abnormal heart rhythm. Yep. So, good question. You sort of pulled me into what we're going to do, what I usually do. So, what problems can children have with their heart, okay? Old people, your parents and that sort of stuff, they get heart attacks usually, occasionally heart valves. It's a little bit less common in children, right? You guys hopefully eat healthier, run around, pay attention during PE.
I eat chocolate.
Eat chocolate?
Good joke.
Yeah. But it's less likely to happen in children that you get heart problems, but it does occur. So the first group of thing is called congenital heart disease. Okay? And these are problems that kids are born with. Right? And there are problems with the structure of the heart. Anybody have any guesses or know anybody that has congenital heart disease? Yes?
My brother has, I think it's called Wolff-Parkinson's-White.
Yeah, so Wolff-Parkinson's-White would actually qualify as an arrhythmia. I'll go into that. That's good. Anybody else? No. Guess, what could you have wrong with your heart? The structures. All right, easy stuff. Like, so this is the normal heart, and if you can see, everything from the right side is separated from the left side. There's a muscle between the bottom two chambers, okay, that separates the right ventricle from the left ventricle. There's muscle between the top two chambers that separates the right atrium from the left atrium, okay? It's pretty easy to have a hole between these two that muscle didn't quite form. This one up top, because it's between two atria, it's called an atrial. This means the top between the top chambers. Septal. Septal is just a septum or something that separates two sides. And defect, meaning there's a hole. So really and truly, this is a gorgeous Latin term that just means hole between the top two chambers of the heart. Okay? So this is the common one. You can have an ASD. The most common one is actually to have a hole between the top two chambers, or the bottom two chambers of the heart, called a VSD.
I have that.
Huh?
I had that.
You had that, and it closed on its own? So actually, I would be surprised that some of you were born with a VSD. Okay? It's actually one of the most common things that children are born with. And a lot of times, especially when the muscle is if it's right in here in the middle of the muscle, over time your muscle grows and it'll close off the hole. So a lot of you will have had it, but no big deal. It goes away on its own, and you get to still pay attention during class. All right, the other problem, arrhythmias. Somebody mentioned Wolff-Parkinson-White syndrome. I wish I had pulled up a picture of that. But this is an example of a really nasty EKG. Yeah. And this is something called torsade de pointes. That's really bad. Somebody has a thing called long QT syndrome, and if they have the wrong alarm go off, or they have a bad episode during exercise, they can go into this. But electrical problems. So Wolff-Parkinson-White. I'm going to go back since somebody brought that up. That's actually one of the more common things. So for this electrical system to work really well, it's essentially like insulated. Everybody has their cables at home, right? You have the electrical stuff going around? Okay. Those cables that Dad uses to connect one thing to another so that he can watch TV wherever he wants to, right? All those cables. Whatever you notice around the outside of those cables.
Rubber.
Rubber. So what is that rubber for? Insulate. Very good. Yeah, exactly. So it insulates. All right. Why does it insulate?
Overheat and explode.
Yeah, so you want that electricity to go in one direction and not everywhere, right? The same thing happens in an electrical system in the heart. This SA node, you want it to start. you want it to spread throughout the atrium, but you want it to spread in an organized fashion. So it's got little bundles through it that keep it organized. You don't want it to go immediately down to the ventricle. So it's actually right here at the level where those valves were, that you can see here. There's actually a skeleton that goes through, a little fiber skeleton that insulates the top part of the heart and the bottom part of the heart. And the only way to get through is through this AV node. Okay? Wolff-Parkinson-White is where, when we were all babies way early inside mom developing, your electrical system wasn't insulated. And so Wolff-Parkinson-White is where there's actually an accessory connection. Instead of just going through the AV node, there's a small other connection outside the AV node that connects the top chamber to the bottom chamber. And what can happen in Wolff-Parkinson-White, and why it causes it, is that instead of starting at the SA node and just going straight down to the ventricle, what can eventually happen is it can go start in this SA node, go down to the AV node, then when it goes through the ventricle, instead of stopping, it'll go back up through that accessory pathway, and it'll create a short loop, and just a short circuit, and just constantly go, and go really fast. Okay? So that's something that I'll get into a little bit when we talk about what different cardiologists do. We can actually get rid of that pretty easily. All right. So other problems that we encounter are valve problems. So I mentioned those valves that have to be one-way valves, so they can leak or they can get narrowed. All right. And then muscle problems. So the problem that's probably one of the areas that I deal with most often is the muscle problems. Okay. So the heart muscle itself can stop the work over time or not work as well. Hopefully, this is going to be a show example. So this is what we call an echocardiogram, which is just an ultrasound of your heart, right? And I'm going to show you a couple of videos, and I want you to tell me which one you think somebody has a heart muscle problem and which one doesn't. Okay, so if you're looking at this, a little bit harder to see because it's not as pictures, but this is what we look like when you come in and you get an echocardiogram. This is your right ventricle. This is your right atrium. That's that tricuspid valve that I talked about. This is the left atrium. This is the left ventricle. That's that mitral valve I'm talking about. Because this is a 2D picture and a heart is a 3D object, right? I can't show you all the valves and every piece of the heart in one picture. So looking at those things, this is the heart muscle all the way around, right? All this sort of white stuff, and you can see it moving. The valves you can see moving. Same over here. This is right atrium. This is, you can't really see the right ventricle on this picture. This is truly taken from true patients. Left atrium, and this is the left ventricle. Okay, one of these people has a problem with the heart muscle. Who? Put up your hand if you vote it's this guy or gal. Okay? So vote for this person. All right. Who votes for this person? Yeah, you're absolutely right. So what happens, so if you look at this heart right here with the heart muscle, what happens is that over time, when it doesn't squeeze as well, more blood stays within the heart and it gets dilated. That's why we can't really see the right side of the heart, because this left side of the heart has gotten really big and dilated. You look at this muscle, ignore the valve, and you just look at these white portions right here. They don't move as much as these guys do over here. See this little speckle? This is constantly moving a good bit. This guy over here is just moving a little bit. That's the problem with the heart muscle. The term most people would use for this is something called cardiomyopathy. It's a big term. Cardio meaning heart, myo, muscle. So heart muscle, opathy, something wrong. So it's a Latin term, just means something wrong with the heart muscle. All right, so within pediatric cardiology, there's a bunch of different types of pediatric cardiologists. All right, there's people who do interventions. So you can think of, these are actually not surgeons, these are people who use catheters, and I'll show you some examples some catheters that we use that do interventions on the hearts. The example being like if one of these valves are narrowed, instead of having to open you up and fix the valve through surgery, a lot of times we can put a balloon in there and use it to stretch it open. Electrophysiologist is a big term, but that's for those who treat with problems with the heart electrical system. Echocardiographer is somebody who reads a lot of the ultrasounds that we just showed you of the heart. And then heart failure and transplant is what I do, and that's take care of the children with those heart muscle problems before and then after they have had a heart transplant. Unfortunately, this video won't play. So what this is an X-ray of somebody during a heart catheter procedure. Here's your heart. Anybody know? Have an idea what these are? Ribs. Ribs. Very good. Help this guy. Diaphragm. Very good. Yep. So it's coming up from an artery inside your leg. Since all your arteries are connected, you can go up through the artery in the leg and go up to the heart. Comes around the aorta, and right here, you see where this balloon is indented? Here and here? That's the aortic valve. So this patient right now has what we call aortic stenosis. That aortic valve is narrowed. Okay? And so if we had the whole ability to show you the video, what happens is that it starts narrowed and they blow up the balloon and they keep on putting more and more and more and more and more pressure on the balloon and they eventually stretch that valve open to where it's supposed to be. Okay? That's one of the things that interventionalists do. A lot of things other interventionalists will do, if you have a narrowed blood vessel that's close to the heart, then they'll go in and they'll put a stent in to keep it open. Okay? If you have abnormal extra vessels, they can put coils in to close them. This is looking at echocardiogram. This is the patient getting one. So you can see the child here just sitting down, and then the person getting the ultrasound has one hand putting with a probe on their chest, and then this is the machine. This is a true representation of what we actually use. Okay, and that's what they're doing. So the patient lies stills, and then you end up getting images like this. Probably is. This one looks familiar, makes sense to everybody usually. The right atrium that we talked about, right ventricle, left atrium, left ventricle. Okay, but all I have to do, and that's when if we get to get this image, you just put the probe down here, right underneath your chest down here. But if I put it up here, closer to your breastbone, I get this image, and it'll look different. But we look at the heart in multiple different ways, because I told you, this is 2-dimension, right? But the heart is a 3-dimensional. We'll look at some 3-dimensional hearts when we get done. Okay? So when I do this, when we do an echocardiogram, we have to change positions of where we're looking so we can create, using 2-dimensional images, to create a 3D picture of the heart. So we look at different ways. We look at it right here. We look at it down through your abdomen, through your liver, up to your heart, over on the side, and even up from the top. Okay? That gets us a full picture eventually. And there are doctors who specialize in reading these things. Electrophysiologists. Those are the people who treat the arrhythmias, electrical problems. Okay? This boy right here is holding, anybody have an idea what this could be? Huh? Metal. It's metal. That's correct. Ever heard of a pacemaker?
Yes.
Yeah. This is a pacemaker that he's holding right here. This is an X-ray of what it looks like. That's that pacemaker. It sits up here in the chest. It goes through some veins, and then you see a lead. This one actually has a lead that's touching the right atrium, and one that's coming down to touch the right ventricle. Okay. So if your heart, this most common reason you're doing this is I went back and talked about the AV node that could make sure that the atrium can talk to the ventricle. If the AV node stopped working, you'd start feeling bad. Your heart rate would be really slow. You may pass out. So what this is commonly used for is if the AV node's not working, then you have this lead right here that senses every time that your top atrium, your atrium contracts. Sends it back to the pacemaker real quickly, because this is all electrical impulse. So just since this is electrical stuff, it goes back to the pacemaker. Pacemaker sees it, waits for a short period of time, doesn't see that your bottom chamber is going to pace, so then it sends an electrical impulse that tells your bottom chamber to pace. Okay? Children can have pacemakers. Your old granny, that granddad are more likely to have pacemakers than children, but it does occur. So we mentioned Wolff-Parkinson and White before. That's this, electrophysiologists are the ones who would actually go and take care of Wolff-Parkinson and White. What they do is they use catheters, just like those people at the interventionalists do. Instead of blowing up balloons, though, they use catheters that have these electrical tips on them. They go in and they find that extra pathway, and they will either burn it or freeze it to make that pathway go away. And then, so I do heart failure and transplant. So that's for kids with their heart muscle is not working incredibly well. Most of the time we can take care of them with medicine, okay? But eventually, sometimes we can't. And I got an example of this. This is something called a ventricular assist device. It's something that a surgeon puts in. It literally sits inside the heart, so the heart muscle can't pump anymore. Can't pump blood out. So you need something to do it for you, right? So I'll show you a picture of this, but this literally sits inside the heart. Sucks blood out. This is a motor underneath that then kicks it out and puts it in the aorta. Okay? It sits inside here, inside the chest, and this is a line that comes out and hangs outside the body that you can control it from. And I got all that stuff to show you. Heart transplant, it happens. So unfortunately, somebody dies, but they're able to give their heart away. At one hospital, we go pick it up, and we bring it, and we put it inside somebody else. Anybody know what's wrong with that? Yeah.
Aren't the hearts like connected into like all multiple veins? So when you take one out, how does it connect itself back to them?
Sure. No, so you're exactly right. So they've got to cut these veins when we connect it, and we got to reattach them during the surgery. Yeah.
Could there be like different?
Oh yeah, absolutely. So you don't want to transplant somebody with a different blood type. You're absolutely right. Except for little babies. We can go across blood types in little babies. Anybody know why you don't want different blood types? Yeah. Yeah, there you go. Antibodies, exactly right. So y'all going to study the immune system, I guess, at some point. But that's the important part. What's your immune system's one job is to say anything that's not you inside of you, got to get rid of it. So that's usually a virus. It's usually a bacteria, something like that, right? So when you get a cold, when you get a fever, when you get strep throat, all those sort of things, your immune system kicks in to try to get rid of it. It will see this, your new heart, as it's something abnormal as well and new. So we usually have to keep these patients on a bunch of medicines to help keep their immune system down. Yes?
So what would happen if you put in a heart in someone like with a different blood type? What would happen to the heart?
So what happens to the heart if you put it with a different blood type is your body immediately rejects it and it stops working. Yeah. Now the difference is in little babies, we've just in the past 15 years, because little babies' immune systems aren't formed and haven't had a chance to work against it, we are able to go across those antibodies because they haven't started making them, and they do well. Yes.
Doesn't that make it like more risky because if you like make sure their immune system is trying to attack the heart, they get like sick more?
Absolutely, absolutely. So after a heart transplant, a lot of our patients do get sick more often, and like most of my patients that had a heart transplant go to school. They come in. We tell them stuff like, okay, if it's January and February and flu's going around. We say, well, why don't you talk to your teachers about how to be able to stay at home for a couple of days while the flu's moving around? They got biggest thing to prevent for infections. Anybody have an idea? What's the easiest way to prevent from infection?
Wash your hands.
Yeah, wash your hands.
Don't touch
It's actually
your
the
mouth.
most effective thing by all means. Yep. Yes. Yeah, excellent question. The question was, how do you keep somebody alive during the surgery when the heart's not pumping? So for any of those things, just like the hole between the bottom two chambers of the heart, if we ever do surgery in the heart, what we end up doing is we have to do something that's called cardiopulmonary bypass. Okay? Big words means heart, lung, bypass. They will put a big plastic tube called a cannula in the vein above and below the heart. Then they put a big tube in the aorta here. And they turn it on, and it literally sucks all the blood out of the heart. brings it outside the body, pushes it around using a motor, pushes it around something that actually does the work of the lungs, puts oxygen back in the blood and takes carbon dioxide out. Then it pushes it back into the aorta. So it does the work of the heart and the lungs, so you basically don't use your heart and the lungs while you're on that machine. You can't be on that machine forever, though. So, good question. Yes?
What happens if you put one of the wrong beings into another part?
What happens if you do that?
Yeah.
It would not be good.
They just die.
Well, it depends on what you connected to what you connected. Yeah, it's a good question. But luckily, so I told you it took me 15 years to become a pediatric cardiologist. The training to become a surgeon is even longer. Okay, so those guys know what they're doing. They train for a long, long period of time. They don't just do it and hopefully make big mistakes like that. Yes?
What age would it start to be harmful, like, to do a heart transplant with two different blood types?
Yeah, good question. So usually you don't go past the age of 2 before you start doing a transplant across blood types. Excellent question. Yeah. Yes.
So whenever you're like transplanting like organs and stuff like the heart, wouldn't like even if you have gloves on, couldn't the germs from other stuff get to it?
So good question. So they're done in an operating room. And the operating rooms are purposely made to be really, really low amount of germs or anything else like that. They're so when the surgeon goes, they don't just wash their hands and do something called scrubbing, which is to remove all the bacteria. They put on sterile gloves, okay, not just the gloves that you guys usually have, walking around to sort of protect you, but these are ones that have not touched any bacteria or anything at all. They take out the heart and they put it in a specialized solution that keeps it without air in it. It keeps it cold as well. So when the heart is not pumping, it's not getting its own blood, right? It's not getting blood to itself. So you keep it cold, and so that way it doesn't need as much oxygen. Everybody know that? Everybody heard, we don't have it here in Texas very often. So a lot of this stuff that we do now started in the 1950s in Minnesota. Why Minnesota?
Because it's cold.
Oh, that's right. They started realizing all these kids that would literally fall through sheets of ice into freezing temperature water would be under there for a long time without any oxygen, but they would still live. And they said, that doesn't make sense to us. They started realizing that when you're cold, your body is cold, it needs less oxygen. Yep, same for the heart. Yes?
If someone dies because their heart stops working or
Mm-hmm.
something like that, would like a heart transplant save them?
Depends.
Come back to life.
Well, that's, depends if you can get them back. It depends if their other organs work. That's an excellent question.
Yeah, like
Yeah. So quick facts for you guys. So what I'm talking about is not unreal. Congenital heart disease is the most common congenital defect. That means it's the most common things that people are born with. It affects about 1% of birth. So it means 1 out of 100. So looks like, just guessing, there's probably about 50 or 60 in here. We're going to do another period with this, so there'll be another 50 or 60. So on average, at least one person that I talked to today here will have had a congenital heart defect. Now, some of them are minor, some of them are small holes that close on their own, some are other things, but some of them are a lot bigger and mean that they have lifetime effects. Sometimes it requires surgery, okay, which means that depending on what the congenital heart defect is, we may have to go in and close it or fix it, okay? But most of these children actually afterwards live normal lives. A lot of these people that you would never even know, they may have a scar on their chest, but they get to go to PE, they get to do things that you otherwise wouldn't expect. It wasn't possible about 50 years ago. This is where I work at Children's, and real quick, healing parts 1. So this is a diagram of a heart. So I showed you a lot of 2D pictures. This is what it looks like in 3 dimensions. Okay? But I mentioned some of the things that we can use in order to help out. This is one of those catheters that I showed. This is a real catheter. It's been cleaned, okay? It's not dirty. There's no waste blood hanging around in it or anything else. Like, this is what I was talking about that looks like it. So for this patient, well, this is actually one that's a catheter-based ventricular assist device. So this thing literally will go in and sit inside the heart and pump blood for it. What we would do, we pretend it's Hannon. Hannon suffers from problems up in her brain, but today we're going to pretend that she suffers from problems inside her heart. So what we would literally do is Hannon came in, she was sick, her heart wasn't pumping her well. Sometimes it's from a virus that affects her heart. Maybe it's just because Hannon's crazy. We don't know. We would start in her leg. There's an artery in her leg, and work this back up until it would come up. Here, hold the end of this. It would sit inside her heart. It would wrap around, and this part would be hanging out. Come out, and it would connect to something that we could control how fast this thing spins. It would sit right here. This portion, later on we'll have the guys come up, sits inside the heart, and this is so it doesn't sit up. Because if you can see this, there's a metal end at the very tip of it that's got like holes. That's where it sucks blood in. If that was to sit up against the heart muscle, you just suck muscle into it, right? That's not what you want. So this piece is to sit down there and hold this metal piece out in the middle of your heart. It sucks out, and then there's another middle piece here at the end that pushes the blood out. So, and this black piece is where your valve should be. So this is something that we can do. It's not meant for life. It's meant for a short period of time because it sits outside the body, right? It comes in, sits out. It's not really good for long term. Yes?
How long do you have to keep it like in how long?
Excellent question. So this is really made to only probably run for 3-4 days. So if somebody came in really, really sick for a short period of time, we put this in. It's a good question though. So let's say what happens if this stays in and 3 or 4 days later your heart hasn't recovered. What can we do, right? Yes, real quick.
So if you put that in your artery, will it pump itself into the heart, and that's how you get it inside of the patient?
Yeah, so that's also in this black piece. So those interventionalists can go in through that artery, and they push it up against the blood backwards. There's a hole right here that you can put a wire, and the wire can go across the valve, and then you push this whole catheter in. The inflow, which is this piece, the metal piece here, will sit inside the heart. The outflow, which is this metal piece back here, sits in the aorta, right above the valve. Okay, and then everything between it, which is this gray part, is literally like a little corkscrew-looking thing, and it just turns really, really fast, and through that it sucks blood out and pushes out the other end. So, the question earlier was about what happens if that's only meant for 3 or 4 days. So, I showed you this picture earlier. Hold that for a second. That's this device right here. So on the left side of the picture, okay? It doesn't have the full graft on it before, okay? What this would do, and something like Carson's got her heart messed up, would sit inside her chest, right, like this. This graft would come around, it would sit and pump blood. This is what we call a drive line. This is the electrical connection. It would come out along her drive line and connect to this device right over here. Okay? This would control that. She'd walk around with this on her pack. It's usually in something like this, overhead back, so it looks like she's got a big old purse or something that she's walking around with, right? So she would sit with it up against here. This line that would come, this drive line would come out right about here, right below, above your belly button, but right below your chest, right below your breastbone. Sit, connect to this device. I'd be, and then as needed, I could turn this up and down. This one is the difference between this device, another one. This is a surgery. In order to get this guy in, the surgeon has to open up your chest and put this guy in. The other one's a catheter-based one. Okay. Patients. I've had multiple patients y'all's age with a device just like this. Okay, and they end up going to school and actually end up doing PE and doing other things, and then eventually usually get a heart transplant at some point. Okay, so this is the question about what you do in 3-4 days. Okay, sit down. Long time ago, ventricular assist device looked like something like this. They're a lot bigger, as you can see. So this versus this. The cannulas for this were too big, really, really big. And so this would usually sit outside the body. This is something called the Berlin heart. Okay, it's the first ever pediatric ventricular assist device ever used. Okay, it's actually made in Houston, even though it's called Berlin. And it's, don't use it too often anymore. All right. Questions? Oh, I have 5 minutes. Oh, okay. All right. If you got a second, if you want, you can come up in between or whatever else. I got some 3D printed hearts that you can take a look at to see what hearts look like. These are actually based off of real patients. What we did is did an MRI of the heart, and then we ended up using material